This is Sister Care Sessions. This is our podcast slash live uh, that we do um, where we just have conversations with different medical professionals, experts. Um, we are doing a series, a reproductive health series, um, with the first part one being the menstrual cycle and what that entails. Hey,
Hey, hey, can you hear me?
I can hear you and I can see you.
Okay, good.
um, I was just telling everyone that part one was basically about the menstrual cycle and how important that is. Today we're kind of moving on to hormones, and we kind of left off on that, but I think that's where we should kind of pick up so it could be like a continuous story because that's what you did mention in the first live is that this is a story. We have to understand it. So I just kind of wanted to kind of go over a couple things. These past newsletters, I've added polls just to kind of gauge where everyone is at. How much do people really know? And surprisingly, most of you guys are pretty on point with the answers. Um, I'm assuming y'all didn't Google nothing. But if you did, I'm gonna charge it to your head and not your heart. Um, so I'm just gonna read the questions, and Miss Beverly here is just gonna answer them because she's the expert here. Um, First question is, what year did women become a part of clinical research?
Yeah, so I'm so glad we're starting here. So Beverly Hutcherson, um, biologist, doctoral student at University Wisconsin-Madison. I have a background in both organizational strategy and human reproductive biology, and my PhD in clinical investigation is merging both of those worlds. But my favorite subject is biology, particularly the reproductive system. And I happen to have been studying that since 2004. So it's been a long time. And the reason why that question is great to start is because the story in 2004 and the story in 2026 has drastically changed. And so as we go through this, you're going to hear a lot of, in the age of kind of science communication, and a lot of scientists and physicians kind of being on the topic, really talking about some of why we don't know as much as we should know about the female reproductive system. And so it wasn't until 1993 when women were a part of these clinical trials, which means what we know for the most part about the human body is based on male bodies. And so now that we are beginning to really dive into the female anatomy, we are finding out that what's true for a male body isn't inherently true for a female bodied individual. So,
Okay.
so that's really important because something as simple as blood pressure, that's also something that was studied on a male body. I would argue in the next 10 years, and is currently happening, they're starting to change even the thresholds for illness based on blood pressure for female bodied individuals, particularly those who are pregnant, because we now understand that it's not just that the blood pressure is different, the structure and function of the heart in a female body is actually different than in the male body. So I would encourage you all to really tap into people online who have the credentials and who are talking about this, because this is rapidly changing our understanding of all things related to the female body. I want to throw something in that for me is a fun fact. So as we begin talking about hormones, one of the things that I hope starts ruminating in your mind as we are now newly really studying the female body, is your understanding of air quote stress, and I use it like this, and its impacts on the body, in my mind, is based on the knowledge we have, but is likely not an accurate assessment of what's happening in the female body. But because we don't have all of the data, it's kind of been a catch all. And as we go through some of the conversations around hormones, particularly estrogen, you'll find that when people are talking about stress, it likely might be a decline in estrogen. So, if you hear the word stress, I want to introduce caution because it's kind of becoming this, everybody thinks everything is stress. And it's just like, I know because I've studied this for a long time that that's inaccurate. But because the information that we research kind of stays in these publications that ain't nobody reading for about 17 years before they actually get translated to the clinic where it would be impacting you. So just every time you hear stress, I want you to question it
Okay.
because it's probably somebody just saying something. Anyway, what was the next question, or did you want me to go into more?
The next question is if knowing the difference between perimenopause and menopause.
Ooh,
Now, from what I can remember from medical terminology, peri means around, like surrounding.
see what you're doing is where we're going. Because the key to understanding any of this is understanding what these damn words mean. So just because they look long, there are root words, prefixes, and suffixes. So this actually, I'm getting my pen out. This brings us back to what we started talking about last time. So last time we talked about the menstrual cycle. So I want you to look at some of the root menstrual cycle right here. So men is in menopause, perimenopause, menstruation. So you have to start saying, okay, we're not talking about gender here, right? So what happens is when you, let me draw my little uterus. All right, so y'all got my little bootleg uterus. So what happens is every month you menstruate.
Mm-hmm.
Back to this, because when you begin shedding that lining, it's called mincing. That's where it's coming from. The word mince. So if you've noticed, have never, ever, ever, ever used the term period. Never. Why are we saying that? Why are we saying that? That comes from shame, lack of education. We just keep perpetuating that. It is a menstrual cycle. It is cyclic. You are going to mince every 28 days. So you're going to have a cycle of mincing. Because we are not using the proper terminology, when we get to perimenopause and menopause, we don't know what the hell it means because
Mm-hmm.
we calling it period. So where does menopause coming from? But if we were calling it a menstrual cycle, then the rest of the words would tell you what's happening.
Mm-hmm.
I implore you to use the appropriate terminology because it is written self-explanatory. So, where my eraser at? All right, so when we mince, we are doing what? What's happening here?
Shedding
We're shedding. So
the
that's our
lining.
menstrual. Yeah, we're
Mm-hmm.
shedding, and we're doing this in a cycle. uh, In a cycle. So what would you guess? Let me get a different one. This word would mean men. Oh,
It's paused out.
So
It's
what does
stopped.
pause mean, right? What does pause
Yeah,
mean?
to stop, uh, to not move, to. But pause is not stop though. Pause is pause. Pause can
Well,
continue.
if you were mincing on a cycle and you paused, what did you do? Did you mince? You paused.
Yeah.
There you go.
Okay.
So that's what it means to pause the menstrual cycle. You are not mincing, you're pausing, right? So
Yeah.
there you go. So then when you said peri means what? You said it mean around
Around. Yeah.
or close to, right?
Mm-hmm.
So what put that together? Around menopause, close to meaning we about to stop. Okay? Because
Yeah.
it's mincing once a month in a cycle, and you're getting close to stopping, but you ain't stopped yet. Do you see how easy it is when we have proper terminology?
Yeah. So it's, I equivalent it to like the yellow light, like you about to
Oh,
start
that's good.
yielding.
I'm feeling that. That's so good. Yes, that is so good. Let me. I ain't got no yellow marker, but yes. So the menopause, that's a red light. Your menstrual cycle, that's a green light, and the peri is the yellow light. That is such a perfect way of describing the process. You're menstruating, you're in green. You're getting peri, it's yellow. Then we get to menopause, we are in red, we are stopping. Oh, I can't wait to use that in my class. Thank you for that. That is such a good way. But do you see why I'm imploring people to use the proper terminology? Because I think sometimes we think we're helping, but I
Mm,
think the language becomes confusing because no one has ever heard of a menstrual cycle. And now we talk about perimenopause and menopause, and the root is missing.
yeah.
So it's key. Look, we can stop right there because I feel like
Yeah.
that clarifies what is happening. Now, what we're going to do is talk about why it's happening. And why this is happening is all based on your hormones. Was there another question before I go to the next stage or no?
Yes.
Okay,
This is probably which probably leads us to what you're going to talk about. What age does perimenopause start?
perfect. Perfect. Okay, so let me bring us back to um, fetal life. So that's in the womb. You're not born yet. You've got birth, you've got puberty. Okay. So these are stages. I think I'm going to do it a little differently. Let me put some arrows up here. Then you have adulthood, and then you have midlife. Right. So this entire time, you have those follicles we talked about. It's all about the follicle and the brain. So let me make sure I get my numbers exact. So we talked about how many follicles you have. Okay, good. Because I'm in perimenopause, I can't remember nothing. Uh, I know it intimately. Um, so you've got about 6 million follicles at this point. And then by the time you are born, you've got 1 million. So what's happening to them?
They're decreasing.
They're decreasing. At puberty, you've got somewhere between 300,000 to about 500,000. Okay. And then for the remainder of your life, they continue to decline until you get around 35 to 55, where you still have them for the most part, but they're not producing hormones at the same level. Okay. So you notice 6 million in fetal life, birth, declining at puberty. At puberty is the point in which you could create a child. Adulthood, you should be having, if everything is working well, you should be having a monthly regular menstrual cycle, unless you are having medical issues and or are on a treatment that is preventing you from having them. And then you're starting to decline, and by midlife you have them, but you don't have as many, and so your hormones are starting to decline, right? So these follicles, as long as they're cycling, you're going to have a what? If they're cycling, you're going to have a cycle.
Mm-hmm.
Okay.
Yeah.
But remember, is it one follicle a month or is it more than one?
Is it more than one?
Well, do you think if you had one per month, would you use up 300,000 in a lifetime?
Yeah.
If
No.
you had one per month, so that would be only 365 a year.
Okay.
If you only had one follicle, you would only have 365 a year. So you wouldn't run through these. We wouldn't ever go through menopause if we only used one follicle a month.
Okay.
It's because we use multiple follicles a month that we end up going through menopause, because at the end, you've kind of used them all up and they can no longer do their job. So let me talk about the job they're doing. Did you have a question?
Yeah, I kind of wanted to make a point. Our last live was the menstrual cycle, and you made it very clear that we're only speaking about what a normal menstrual cycle would be. So you can use that as the baseline to know what a maybe abnormal one is. So are you using this that same tactic with perimenopause and menopause?
Yeah. Yeah. And the reason why we're doing that is because for the most part, people only want to talk about something when it's a problem. But I'll
Mm-hmm.
use an example. If your TV is working functionally, the only reason you know it's not working is because you know what it's supposed to be doing.
Right.
So if we only start talking about diseases, which is pathology, without understanding what is normal, you won't know that something is abnormal. So I've
Mm-hmm.
been doing these workshops for many years to all different audiences. And I was doing a workshop at our local welfare office. And every time I do this workshop, I end up having like a line of women who are saying that what I just said is not happening. So this becomes the moment they know, some of them already have children, that
Mm-hmm.
something's wrong. So I had a woman who's saying she's bleeding for 2 weeks. Menstrual cycle, 3 to 7 days. She's bleeding for 2 weeks. I've had one say she wasn't getting one and she wasn't on any medication. So sometimes we think a lot about bleeding too heavy, but it is equally challenging if you're not bleeding at all or too light. So you have to know what that baseline average is so that you can say, okay, this is not normal. Now I need to go seek medical care to figure out if something's wrong.
Mm-hmm.
So it's important to understand what the follicle is. Notice the whole time we haven't talked about eggs. I'm trying to get you to understand the egg. I'm getting ready to draw it, is inside the follicle, and it's important that you understand, because it's not eggs, it's the follicle. And the fact that we keep calling it egg is why we're not understanding what's happening. So all of this starts, which is why this happens in fetal life. This all starts in the brain. And so you have your brain, and there are two pieces. There's the hypothalamus and the pituitary. Oh, don't get me spelling that wrong. I'm here all on the internet with wrong spellings. Okay. So this is important. And I'm going to say, because when people be talking about the hot flash, it's like everybody's always talking about that as if like that's the only or even the most prominent symptom. And I wish we would stop starting there
Hmm.
because there's so many like popular things that someone may not be experiencing, and so they don't know they're in perimenopause because they're like, well, I'm not getting the hot flashes. Even when you go to the provider, they start with asking about the hot flashes, and it's like, okay, how about we start with a list of symptoms and ask someone, which ones are you exhibiting? Because when you talk about something so much, people think that's the hallmark sign that you are going through something. So for all the providers out there, and I know y'all don't get trained on none of this, but expand your knowledge base and stop talking about hot flashes, because not everyone is going to experience that. There are over 40 symptoms of menopause and perimenopause, right? So stop talking about that one. Just treat them equally so that someone who could be experiencing any of them can say, I think I need to act. So I had a friend, I'll give an example. One of my friends, she's MD, PhD, and I went over her house and visiting, and I noticed that she was having anger issues and depression. And I said, you might be in perimenopause. So that's what I'm talking about, this brain. So
Hmm.
we think about the symptoms being the menstrual cycle. That's only one of the aspects, because the hormones we're about to talk about, they have receptors in all parts of your body. So you're going to have a whole system impact. Whole system impact. That means you might decide, oh, it's because I'm 35 that my knees are aching. Might be perimenopause. I'm having stiffness in my
Frozen
shoulder.
shoulder.
Yeah, or it might not even be frozen shoulder. It just
Yeah.
could be aching that you've never had before. And you
Hmm.
say, it's old age. You're too young for it to be old age. You're 35. You ain't 65.
Hmm.
All of this are signs of perimenopause. You might start getting acne. You're like, what's going on? You might have thinning hair, going through pieces of alopecia. Your hair might be different. And one thing we're going to talk, you might start growing hair in places you've never had. That is definitely a sign of perimenopause, right?
Hmm.
And we're going to talk about those hormone shifts. So that means every physician, no matter their specialty, needs to know the signs of perimenopause, rheumatology, etc., because these hormones have been keeping us steady our entire lives, even before we were born.
Hmm.
And the decline of them will be a whole system impact. It could be swelling ankles. It could be, if you have a chronic issue. For me, my first sign, because I'm chronically ill, I've had a lot of surgeries. My first sign of perimenopause, and I studied it. So it was like I had surgery every year for 4 years. And I'm like, what's going on? And I'm actually writing my thesis on the reproductive system, and I'm in a meeting with my advisor, and I was like, I'm just getting sick more than usual, and I'm not recovering as fast. And we were in a meeting, and I said, Dave, wait, am I in perimenopause? He was like, bloody hell. He's from Scotland. He's like, bloody hell. He's like, every one of my doctors are so worried about my normal symptoms. It never occurred to them that I might be in perimenopause that was causing them to worsen. So if you have chronic illness, it may worsen, because remember, these hormones affect every part of your body. So I hope that resonates with someone.
Yeah. And okay, when it comes to like mental health,
Yes.
before you get any diagnosis, they want to give you a questionnaire. And then they'll determine if you are mildly depressed, acute depressed, severely depressed. Why isn't that same tactic used for perimenopause?
Because they're not
Or is
trained
there
in it.
different levels?
It's just not trained in it. So on average, medical students get about 2 hours of training in any of this. So it's not that your doctor is trying to misdiagnose you. It's just the fact that Women weren't studying until 1993. It goes back to that. And this is not a training. To be a menopause specialist, you have to go to additional training. Even your OBGYN didn't get trained in this. So, and the research on this is new. So, remember, I told you it take about 17 years.
Yeah.
So, just because people are studying it all over the world, it may not have made it to your doctor. So, it's not, it's a failing. Patriarchy is the answer, and we get to the root of it. Not studying women is the reason why tons of women, half the population, are one being misdiagnosed and not being treated because physicians are not being trained. Just earlier today, around 11 o'clock, I went to a congressional online. I went to a congressional policy conversation about menopause. So you have women in Congress who are pushing across the United States for policy that mandates that this be an education in medical school and in residency for all physicians. There's also a lack of funding for women's health research. And also, just so everyone knows where this research would fall, it falls under the Institute of Aging, because as we talked about, this is something that happens as you age. So this is, but when I say new, I'm talking new. So it has not, if you already got your doctorate degree a long time ago, you're doing what you know how to do. But the new research that came out, you ain't read that. So that's because that's not how it works. Like physicians are not inherently scientists. Some of them are, but not inherently. They're practitioners. So they don't necessarily get the latest information and are able to practice in that way. So that's why understanding what's happening to the brain, for example, when we talk about hot flashes, that's a brain issue. That's a brain issue because your brain is going to be regulating your temperature. So, yeah. So when I talk about depression, they're just now realizing that the female brain does not process serotonin and dopamine the same way the male brain does. This is all new information. So if you ain't, yeah. So they're starting to understand the role that estrogen is playing, the decline in estrogen is playing in mood stability. So all of this information, I mean, it's coming out like wildfire. It's hard to keep up with because this is such a hot topic right now. It's only a hot topic because more women have gone to school to become scientists and physicians who are living through these things and are starting to being like, I didn't even know how to treat myself. So I think her name is Dr. Mary Claire. She talked about, she's an obstetrician, gynecologist, and she talked about how she was a really bad menopause doctor until she started going through it because she was saying what she was told, not realizing until she started going through it, she ain't know nothing. So she wrote 2 books on it and everything. So that's why when people talk about like diversity in science and medicine, they think it's about people looking a certain kind of way. But experience matters. If you've never been through pregnancy, if you've never been through a menstrual cycle, you don't know what hurt. How you gonna tell me that this don't hurt? You ain't never had it. Shut your ass up. So, like, how you gonna tell me? You don't even got these parts. So that's why that diversity becomes important because when you start, like my obstetrician, she was pregnant when I first started working with her, and I said, I wonder what your practice is, how your practice is going to shift after having lived through birth. Because how would you know? Oh, typically people feel this way. How you know? You ain't even never been through this. So it matters that you embody these things because perception of pain when you have been in that pain is the game changer in your practice and also in the research questions that you ask. So let's lay out the kind of base hormones that we talked about. So we've got these two, which are in the brain, right? And so this is given a hormone called gonadotrophin releasing hormone, which is going to lead to 2 hormones that come out of this, which is luteinizing hormone and follicle stimulating hormone. All right. So these hormones you might not hear about a lot. You hear a lot about estrogen, but here's the reality: without these, you don't get none of that.
Mm.
It's not the way hormones work. They, how do I describe this? They work in a loop. So this goes to this to get this. So your body has these pre-messages that will send to get the thing that it wants. It doesn't just make the one thing. So this the brain has to give a signal that's going to communicate with the ovary to say we need a thing. And then once we get that thing, the ovary is going to communicate back to the brain and say, we got enough of that. You can stop that. Right. So there's this communication of saying, thanks, we got it. Oh, we need a little bit more of that. Oh, we ain't got none. So this perfect symphony that is going from your brain through your blood system and landing on the follicle. And this is what's happening. So then we get down to the ovary. Okay, the ovary is going to produce some hormones that maybe you don't think is being produced in the ovary. And this is important when we're talking about perimenopausal changes. So within the ovary, I wish I had a second one because I want to leave this up here. I need to draw this follicle so that you can understand that there's this thing that's happening, this really complex and beautiful thing that's happening in the ovary called steroid oogenesis. So, steroid is a type of hormone, and it genesis means making new. So, we are making steroids. The steroids are the hormones that everybody's talking about, right? So, there's a flow to it though. So you're gonna get, and I'm gonna skip some for all the other scientists that you missed on. We talking to regular people. I'm putting all that stuff up here. We'll put the key ones up here that matter to the people. Okay. So don't come for me. I know what the rest of them is, but we ain't talking about that right now. So you're gonna have within the ovary, you're gonna have the follicle, and it's going to go. So these hormones are gonna land in the ovary, and they're gonna produce. This is the precursor hormone that's going to produce. Can you guess what T is?
Testosterone.
Yeah. And that is going to be converted to estrogen.
Mm.
Okay. So you might not know that you have testosterone. You need it because your body will take testosterone and convert it to estrogen. So both male bodies and female bodies have the same hormones. The only difference is the amount. So our dominant hormone is estrogen, but a male's dominant, they're going to have estrogen, but they're going to have less estrogen and more testosterone.
Mm-hmm.
Now, in perimenopause, that's when it becomes a challenge. How do you know? When you meet someone who is in the postmenopausal state, you might notice some chin hair, a little bit of a mustache, chest hair, deeper voice. So, what would you think is happening during the perimenopausal transition? If testosterone is converted to estrogen as our dominant hormone, what do you think is happening in the transition? We get more estrogen or less estrogen?
Less.
We get less estrogen, which leaves room for,
More testosterone.
yeah. So we start having male pattern hair, deeper voice, all of this stuff because that's the hormone that's starting to dominate because we're
So
the
it's kind of some truth to like menopause being like the second wave of puberty in a way.
oh yeah. Is whatever term we gonna come up with, it's definitely because it is a huge hormonal transition. So puberty is the onset of this system, right?
Yeah.
So the second wave is the decline of this system.
Mm.
And so you're going to get some other pathways that were not dominant to become dominant. And then that's why your body is supposed to be operating on estrogen. You got estrogen. Estrogen regulates your blood vessels. So, what is the leading cause of death among women in midlife?
Uh, heart attacks.
That's it. What did I say? Estrogen controls blood vessels.
Testosterone. Mm-hmm. That's, yeah.
So you might have high cholesterol, no matter if you're eating right and exercising. That's why I keep talking about all that. There's so many things that people be saying and they hadn't studied this. So you can do all the right things. And when you talk to people who are perimenopausal, they'll say they've been doing the same thing they've been doing and it ain't working. They're gaining weight, they're doing everything they can do. It's because this is dysregulated. So the things that it controls at a certain level, once that level declines, it's not controlling it anymore. And one of the things that it controls is metabolism. It has impact on metabolism. So you could be eating healthy, but your metabolism is not the same. This isn't about air quote old age. This is about hormone dysregulation. So you've got all of these things that are happening. I told you, your hair might be thinning. You got achy joints, the musculoskeletal syndrome. This is all new. There wasn't no 20 years ago. We weren't talking about no musculoskeletal syndrome of perimenopause. This all was published last week. So it's like, we're talking about fresh off the press stuff that every
Mm-hmm.
physician has not read and it has not become standard practice. You're going to have gastrointestinal issues. You might get sicker more because your GI system is the core base of your immune system. Your core base of immune system is in your intestine. And so if your estrogen is helping regulate that space and it's reducing, you might see that I used to never get sick and now I'm getting sick. When I say whole body, I mean whole body. So I notice I see some people that have that one little chin hair plucking it. You see that chin hair and you ain't never had that chin hair, questioning whether it's perimenopause, right? So now that you have, well, look at the time. Okay. Because I can get going. Okay. So
Yeah, I
now
know.
that you, so now that you know that decline in estrogen, it's not converting as much. So you may be getting some kind of free floating or more testosterone that might be impacting a number of different things that are happening. Vaginal dryness is one of the things that might be happening. Vaginal atrophy, right? Vaginal atrophy can happen during that time. And so to replace estrogen requires a medical consultation because when we talk about hormone therapy, there are many different approaches because I want to talk a bit about what actually hormones are. So I can delete this. So a hormone in the body is a messenger. And I'm going to just make this. This is what we're going to call a receptor. Okay. And this, what the technical term is ligand. And basically what that means, then when we talk about hormones, they're just proteins. So in
Okay.
your body's going to go from DNA to RNA to protein. And what that means is your DNA encodes for things that tells the body what it needs. And it needs to give this message to the body. So within your body, you have an alphabet because there's this thing called cellular communication. So these cells that you can't see, they're communicating with one another. And in order, the DNA, that is the bank. Everything that the body needs is within the DNA. But we don't need all of it at the same time. So your body's going to have these messages and they're going to send the message. And the message is going to be translated into the thing that the body needs. So your DNA is the bank. It's kind of like you with the drawing. You go say, okay, I need $50. They got to go back to the bank to get your money, right? That's what the DNA is. That's the bank. And they say you send that message and they say, okay, we need $50. But if you're going through perimenopause and your body say, I need $50, and they look at your account, it might be negative.
Insufficient funds.
Yeah, insufficient funds, baby. We ain't got it. We in the negative. So what it might give you is $2. But your body needs the 50 to function. So it gave you the $2. So you only had two of these to match. Because what happens is this is, say, estrogen, and this is where it's supposed to land. And it's going to have all of these things just open, waiting for these hormones to land. So all of these are supposed to be filled, but we ain't got enough. So this one is open. So then what happens is inside those cells, the function starts to decline. It doesn't have what it needs. So when we talk about hormones, that's all they are. They're just the thing that your body needs to function in that part of the body. That's all it is. That's all they are. So let's just try to make it easier to understand, because when we talk about hormones, it just sounds like this mess of things, but they're very specific to different parts of your body, and they often serve more than one function. So people will say, oh, this hormone does this. Probably does something else too, but that's the only thing you was looking at. So they tend to have more than one function. They do. They rarely just do one thing. But the one thing we know is likely the one thing we studied, which is why we continue to do research, because we might say this thing did this one thing. My whole thesis was built off of that. There was a protein they didn't even think existed in women. Then somebody found it in a mouse. Then all of a sudden it's in women. Wait a minute. It's more important than any other hormone we've ever looked at. Now they're using it in infertility studies, but nobody was looking at it. So it was always there, but nobody was looking at it. And so our science is only as good as we've looked. So I don't fault physicians or scientists. It's just, we're just figuring stuff out. So that's what happens with these hormones. So they just proteins, they got to land on something. When they land, they send messages in the body and telling it to do what it's supposed to do. And when you ain't got enough, that function in that area will decline. I want to go back to one thing. Go back to the follicle. So I want to draw it. I'm going to give you all another scientific term because I like doing that. So we go to the follicle. And the thing about it is follicles have multiple stages. We can go get into that. We might have to get into that in another session, but it's really incredible. So they have, so this is like one piece. Remember I told you the egg, that's inside. But then on the outside, you've got these layers of cells. Even though this thing is so small, you can barely see it at first, right? And then as it begins to what we call mature, it gets even more complicated. So it starts off with like one cell type. And then as it matures, we get multiple cell types. So when I talked about steroid oogenesis, the reason why the follicle, which is carrying that egg, starts off as one thing. And then when it begins to grow and mature, it becomes this complex communicating thing. Is because this is where those three cells, that's where you're making that testosterone going to estrogen and the progesterone. All that's happening inside this little thing. So because it's happening inside this and it's keeping your body level, in each ovary, so this maybe is one ovary, this is another ovary. So we were to like zoom in, this is what's happening. But you can't just have one of these, because one of these will not produce enough hormone to keep your body at level. So you're going to have, say, 20, they're going to all be slightly different sizes. And what do you notice about what I'm drawing here?
They inside one another.
Are they the same size?
No.
Yes. Okay. So based on, this is ovary number 1. This is ovary number 2. On average, you're going to have about 10 to 20 of these in both per month. Why is this important? Because every single one of these, they are producing that hormone that keeps you level. Okay. But based on the size, which one of these ovaries will ovulate that month? The one that's the biggest.
Okay.
So that would be this one.
Mm-hmm.
So this one will ovulate. So that's going to pop out. And then you will get the egg. Because the rest of this stuff, it, I'm sorry, I'm getting excited. But anyway, because if you understand the follicle, you understand how all of this is necessary to maintain your level function. This whole cycle and these multiple things. So, okay, if this one pop out and it ovulates, what happens to the rest of these?
I don't think they die, do they? They may. Oh,
Yeah,
okay.
that's how you lose them. They
Okay.
will cycle, produce your hormones. That was their job. It's not wasted. They were never all supposed to, you're not supposed to have 500,000 babies. Them growing and producing the hormone to keep the body functioning, that was their job. Their job lasts for 28 days.
Mm.
When their job is done, they die. And then a
Mm.
new cycle begins.
Okay.
So that's what that is. So these are going to die. Now we in perimenopause. This is what it's looking like. What just happened? You have the
Mm.
same amount?
No,
Yeah. So what's happening to that hormone? You don't have the same amount of follicle cycling. What's happening to your hormones?
they're decreasing.
You ain't got that much to this month.
Yeah,
Okay. So now we're moving along the perimenopausal cycle. What's happening? Getting less
decreasing.
and less. They're getting less
Yeah,
and less. At this point, we just putting along. Now, when you get to looking like this, what you will see is irregular menstrual cycles. At this point, you might be missing a couple of months. You might get 6 a year,
mm.
which sounds awesome, except for the consequence of that of all these other symptoms, a little chin hair and all this kind of stuff. So I mean, what we go through is just unfair.
Yeah,
So you finally don't have to have that stupid cycle anymore, and now you got all this other crap now you got to deal with. So just give me the cycle, right? So now you're having less. This is a very risky time for pregnancy. So if you're not trying to get pregnant, this is when people start acting a fool
mm.
because they don't understand that the medical definition for menopause is 12 months without a menstrual cycle. So people will think they're in it because they haven't had a menstrual cycle for 8 months. Not till 12. Because that 9th month, that's how you see them people 50 years old with that 1 year old because they thought they were in the clear. No,
Mm.
if you have had no surgery to remove your ovaries, 12 months. If you have not hit 12, if you got 11, nope, 12 months with no menstrual cycle will give you the definition of menopause. But when you're having couple here, couple there, you don't know when it's coming, when it's not coming. That's a very risky time to have that oops baby because you think you're in the clear, but that might be the month you ovulate.
Yeah,
12 months, and you want to have that confirmed by a medical doctor, then you have menopause. Then that means menopause is really that day, right? So perimenopause is anywhere between 35 and 55. But menopause is just one day. The day you have reached 12 months without your menstrual cycle, you are officially diagnosed with menopause. And then you enter what's called the postmenopause stage, meaning from this point on, you will not be fertile or having any menstrual cycles. So it's clear to understand that menopause is just the day you are done with your menstrual cycle. And then postmenopause is the state where you are now infertile and living in that postmenopausal space. Now, I want to point out a couple of things. Um, that is only if you've not had anything that has stopped your cycle medically. So, if you have had your ovaries removed, both of them, not one, you can still be fertile and functional with one ovary. But if both of your ovaries have been removed through the oophorectomy, we talked about that last time,
Mm-hmm.
that day both of your ovaries are removed, you are now in surgical menopause. So the menopause we just talked about is natural menopause, the natural cycle. Then you are in surgical menopause. Now, here's where it gets tricky. So remember, removal of both ovaries, surgical menopause. But what if you've had a hysterectomy,
Mm-hmm.
your uterus removed, and you're not having a menstrual cycle, but you have your ovaries? Are you in menopause?
Yeah.
No.
You're not?
What is managing? The follicles are still there. Are the follicles still
Mm.
producing hormone?
Yeah.
Yes.
Yeah.
Yes, you are not in menopause if you still have both of your functional ovaries.
So, but what if you just have one?
Still not in menopause.
Still?
No, because remember, as long as you got functional follicles, you are cycling hormones.
Okay.
The
I remember. I
hormones,
remember you saying that last time.
yeah, the hormones come from the follicles in the ovary. They don't come from the uterus. The follicles in the ovary manage your hormones along with your brain.
Okay.
Okay. As long as you have functional ovaries, you are still hormonally cycling, even if you are not having a menstrual cycle. That's why the language is important because mincing is what?
Shedding.
Shedding
Um,
what?
the uterus lining.
Yes. They ain't got nothing to do with this because this is a whole different part of the body. These are different organs. So let's map
Okay.
that out.
So if you have one ovary with no uterus, but you still have a cervix,
Hmm.
that's surgical.
Yes. That's not no, no, no. As long as you have functional ovaries, you still are cycling hormones.
What?
Yes, that's the problem with the definition. It's flawed because they didn't have this kind of science when they came up with some of these terms. So the follicle, I just published my thesis last year, so they don't know all this. So the follicle, the ovaries are the site of the hormones. The uterus is just shedding the lining. So we've been measuring it by what we could see.
Uh,
We have additional knowledge, so they really need to update these definitions. Surgical menopause is because you've taken those ovaries out, it's a wrap because
mm,
the ovaries are the site of your hormone production for the reproductive system. But if you still have any functional ovaries, you're still cycling because the follicle is still doing what it's doing. You will not have a menstrual cycle, but you will still ovulate. You will still have hormonal changes. I know this because I'm one of those people. I'm not in, I said I'm in perimenopause. I lost my uterus a long time ago.
so that would mean they're still in perimenopause, right?
I'm in perimenopause because I still have both of my ovaries. I only have ovaries. I don't have fallopian tubes. I don't have a uterus. I don't have a cervix. I only have ovaries because the ovaries are what's controlling it. So I am not I am not at menopause. If I had kept my uterus and lost my ovaries, then I would be in menopause
Mm,
because they are two different functions.
hmm.
The ovaries are the key to your hormone cycle. Your uterus is where you would hold a baby and develop a baby. They're not one organ. They're
Mm.
different organs and they have different functions, but they influence each other.
Okay. So is it still possible? that a woman can have one fallopian tube, one ovary, no, still have the cervix, no uterus, can they still display menopausal symptoms?
Of course, because you have the ovaries. As long as you have ovaries, the answer is always yes. If you
Okay.
have functional ovaries, the answer is always yes. Because
Okay.
the menopause, that's why the definition is flawed. The only reason that you stop mincing is because your ovaries have declined in. The ovary is the cause of the menstrual cycle. The ovary is the driver,
Okay.
not the uterus. But that's I guarantee you that definition will change because now that we have a deeper understanding of the role of the ovary, we understand that the ovary is really in charge. So someone like me who only has ovaries, I'm still perimenopausal. Now here's the challenge. If you have had, now new research has shown, if you have had a hysterectomy, you will likely go through menopause 5 years earlier because there is a blood supply from the uterus to the
Hmm.
ovary, and you've lost that blood supply. So you might go through it early, 5 years earlier after you've had, but you will still be in a regular cycle. I lost my uterus and all things in my 20s. No side effects except for the joy of not having a menstrual cycle. But because I don't mince, that's why nobody was thinking about menopause.
Mm. The language is really important.
Yes. Do you see how confusing it is if we talking about a random period?
Very.
It doesn't explain a damn thing. And if we talking about eggs and not follicles, you're not understanding because you think it's about having a baby. No, there are multiple functions to the ovary. The ovary is the site and the producer of your reproductive hormones. It's the key, not the uterus. So, but if you don't know that their follicle holds the egg is within the follicle, but you're not supposed to have 500,000 babies, then you recognize that one function of your reproductive system is reproduction. It is an endocrine regulatory system that has impact on your metabolism, your brain function. So this is new knowledge. We have centralized it so much that people just think about it from sex and babies. Meanwhile, you're about to have a heart attack because damn ovaries. So like, that's the thing. But this requires us to educate on language because understanding menstrual cycle, mincing, peri, it all starts making sense. Understanding what the parts do,
Hmm.
understanding what you can take away and still have this. So they cannot use the definition of 12 months without a menstrual cycle with someone like me. Why? I don't have a
Remember?
uterus.
Yeah.
So update your language. Yeah. So I even with my doctor, who's well aware of that I lost my uterus and cervix and fallopian, he was like, "Well, have you been 12 months about a menstrual cycle?" I said, "Since October 2009." And he was like, "Oh yeah, I forgot about that." And I was like, "Right." So we have to go off of hormones. We can't measure based on menstrual. See, the hormones are driving your menstrual cycle. So if you don't have a menstrual cycle, that's why you have to measure the hormones. They know what my hormones should look like. So when they tested the panel, the hormones that we haven't even got into because we ain't got time, but the hormones that they tested for were low. They
Hmm.
looked at the thyroid. They looked at all kinds of things to say, oh, this is where you should be at this age. You are below that. So you're perimenopausal. But how do we know that I'm not menopausal? Because I still cycle. I'm 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 cycling now. Every 20s. I have to look at the calendar. When I start getting cranky,
I know.
I look at the calendar, so it's the 20s. So that would be my PMS. When I'm ready to fight somebody, I look at the calendar, I say, okay. I ovulated that month. But there, I ovulated that month because I know I was ready to fight somebody. So that's how I know. Especially if I start getting sad for no reason, I look at the calendar. It's always between the 18th or the 22nd when my mood drops. That's how. So I have to measure by symptoms that
Oh,
I've had since I began my menstrual cycle as a teenager. So I measure that. So I know, no, I cycled that month because I was ready to fight somebody that month. Or I know I cycled that month because I was sad for no reason. So I have to go by those things. Or I was bloated and all the things. I still get all of those symptoms because the hormones are the reason for the symptoms. I just don't get menstrual cramps because I don't have a uterus. So I hope this helps anybody who might not have all of the anatomy to understand how do you determine if you're perimenopausal if you don't have a uterus. How do you know if you are going to get your ovaries removed? Immediately, you need to talk about menopause and hormone therapy because they just took it away and you're going to go through hell. So you could be in what's called chemical menopause, which I've experienced, where they will give you synthetic hormone to override your brain so that you are not cycling for medical reasons, which is what led to all of the surgeries that I had. So I
mm.
had to go through chemical menopause because they just need to shut the system down to save my life. Right. So they shut it down chemically. And then they were able to take me through emergency surgery to remove my uterus. And then I was in a different space. So,
I got a question. Okay, what is the process of, I don't know what it is, but you get five women in a room, they live together for a long period of
oh, the
time.
syncing up.
There's what is that?
No
How does it
clue. I don't have the science behind why that happens. It is not unique to humans, though. It
mm,
is likely related to evolution. So if you go to animals in the wild who mince, they will sync up. There's also, I was just looking at a study that human Homo sapiens women, and I can't remember what island, but those women only had 4 menstrual cycles a year, and they would only reproduce every 4 years. So we would have to do a part three on the social impact of biology related to reproduction. So, in an environment where food is scarce, in an environment where, so like for example, um, that's why we got to do. That's why we're doing this series because there's so much to talk about. So,
yeah.
for example, if you are lactating, you're breastfeeding, and a baby cries, you will produce milk. It ain't your baby. But if you go back to communal environments, people breastfed as a community.
Yeah.
So when I was nursing, like other babies could smell that I was nursing. I remember as my son was nursing, I was in a room and his little cousin, they were the same age. His little cousin was trying to slap my kid because he also was a nurse. Little babies don't care because it's just milk to them. But
Mm-hmm.
a breastfeeding baby knows they smell the milk. They can tell when there's a nursing mother, and they will try to nurse. They don't care who you are. So there's how we function in society that we've designed, and there's how we would function primitively. And our biology didn't change because we started going to college and doing all this stuff. So I think we got to come back to talk about um, society,
Mm-hmm.
kind of an anthropological lens on like syncing up cycles and lactation,
Mm-hmm.
the role of don't get me excited. The role of
Okay,
lactation.
that's part three.
Yes, we don't even talk about pregnancy at all. So like it's such a fascinating topic because we don't go into the depth of it, but it's so cool. I took a whole class on lactation, like just a whole class on the science of what it does in the body and how it the role that it plays in shrink. Your uterus gets so gigantic, and you
Mm-hmm.
have to ask yourself, well, how does it shrink back down? Hormones. So there's a whole, like, we just talked about normal menstrual cycle, where we go through from menstruating to reducing our menstruating, how the role that the ovaries is doing. We haven't really dived in. We talked about that the brain plays a role, but we really haven't dived into the role the brain plays, and it really is key, especially when it's not getting that estrogen feedback. It starts going crazy. I know because I'm living it. You can't remember. I can't remember a thing.
I know.
It, it is,
I got
we be
you.
trying to have meetings. I'm trying to making a sandwich. I can't remember a thing. And it's like I remember I just before earlier, I was like, I went in my bathroom and I looked like I had did something in there. I have no memory of ever being in there. Like I was like, no. So, but that's because that's how I know I'm perimenopause. So I'm not. I may be cycling, but my estrogen levels are dropping. I'm not having the same symptoms as someone else. For me, my dominant symptom is what they call brain fog. It's
Yeah,
gone. But it's also, and then they also are talking about women who are perimenopausal masking, or being in your normal hormone levels, masking things like ADHD, which I think is probably not an accurate description, but that's just what they're making up right now. But anyway, don't get me started, because I feel like there's a lot of people who don't study the cellular and molecular biology, who are just don't have this, they don't understand that you're just making statements.
yeah,
Like, it's not masking ADHD. Perhaps it is a fundamental brain shift that looks like or mimics the symptoms of ADHD. But that would take you to actually be a neuroscientist to dispute that you're masking a disease versus a fundamental brain shift, which would take MRI studies and things like that, which they are doing. So I think what I find with some clinicians, they they read one article. That's not how any of this works. People studying 30 years one hormone, but like you read one article and you're like, scientists have found. That's not. That's not how science. That's not how research works.
yeah,
Usually, you would need a collection of data to then have a definitive understanding. Oftentimes, it is insight, but not a definitive understanding. You can't tell me something published last week is the answer. No, it's insight. So
yeah,
I think that's the difference between being research trained and being clinically trained. You're looking for quick answers. As a researcher, I'm already reading that paper and being like, it's like, I don't know about that. So see, don't get me started. But we're okay. We're gonna stop.
I know we are at the hour, so I think it's time for us to kind of like regroup. We talked about lots, some key takeaways. I think for me is again understanding the language and familiarizing yourself with the language, and also paying attention to your symptoms, like understanding them like the back of your hand. Because
Yeah.
in order to get the care that you need, it comes from the symptoms that you have.
Yeah, you
So
got
it's
to be able to tell your doctor, this is not normal for me.
right.
They always talk about something normal. No, it's not normal for me. I don't care what's normal. We ain't talking about her. We talking about me. And you have to say, this is not normal for me.
Mm-hmm. Well, what you want to take us? Key takeaways.
Um, Definitely, I'm going to, every time we talk about this, I'm going to encourage you to remove the term period from your 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 lexicon. It's not serving you. It's a
Mm-hmm.
menstrual cycle, because that root understanding explains everything else. The other piece, the ovaries are the key, right? The ovaries are the key. There are more than one type of menopause. Please understand that. There's the natural process of menopause, there's surgical menopause, there's chemical menopause. Also, the definition of 12 months without a menstrual cycle applies to someone with a uterus. If you still retain any functional ovaries, one or two, you could still very much be hormonally cycling for which you would then need to map out your symptoms every month. So
Mhm.
that definition is outdated and needs to be upgraded. Women have not are just now being studied by women asking questions from people who've lived through it. And so we are in a global revolution when it comes to women's health. And the other thing is that every physician, regardless of specialty, should have an understanding of the role that perimenopause, which is a reduction in your reproductive hormones, has on every system of your body, because it is not limited to having a baby, having a menstrual cycle. It is also involved in your immune system, brain health, heart health, all of these things your reproductive hormones have impact on.
Okay, I just know after this, part three is going to be really good.
I know
Um,
so many directions we could go in. Like we
I
got to ask the
know,
people what they want, because
I know.
I'm always ready to talk about whatever. So
Okay, well, I guess I got to do another survey just to kind of check the temperature of the people. But I do want to mention that I had the opportunity to meet with the founder of her Plum LLC. Her name is Natasha, and she um, is her specialty is womb care. And with her personal story with fibroids and all that, her company created reusable sanitary napkins.
mm,
She wants to get people to think about the chemicals that are in these products and kind of go more of a natural way. So she blessed us with a promo code. The promo code is womb care. It's a space. So WOMB as in Bob space care, and you can use that and get 20% off your purchase. So I want to thank Natasha and her Plum LLC for allowing us to use our the promo code. I will be meeting with her next month, so she can talk more about it. But as usual, I was mind blown. I've learned a lot. I'm so glad we're doing these sessions and series, and I hope you all learn something. As always, I will be reposting next day repost. I'm going to be on YouTube too, so it's going to be on YouTube. If you are a Spotify person, it's going to be on Spotify. But I think you should look at the visual so you can see the board.
you
So
know, I don't know how people can teach this with words. Like you can't if you've never seen inside your body, it's not helpful. I'm like, you got to pull this stuff out. Like
I
you
know.
gotta
I love
see
those
it.
things.
Like I got my little ovary and my
Oh,
fallopian
okay.
tube pin on. It matched my shirt. But like, yeah, we gotta draw and ask questions. Like I think this conversation has to be a conversation. It has to be a teaching, not a telling. It has to
Yeah.
People need to be taught like they are in a class. Otherwise, it
Mhm.
doesn't stick, because these like people need time to process information. And when you're drawing, it slows you down, because you see how I can get going, and then
Yeah.
when I start drawing, I get so excited.
Yeah.
I'm such a nerd.
So, thank you. Thank you for just taking a chance on Sister Caroline's and wanting to educate us all um, on things that hopefully empower us a little bit more to advocate for ourselves. Because I think that's just the overall message. The more you know, the more you can ask questions, the more you can second guess, maybe have the courage to get a second opinion. So knowledge is power, and I thank you, Beverly, once again. We'll be doing this once again. However many episodes of this you want, I'm here for it because this is good information.
Yes, awesome. You guys have a good night.
Good night. Bye bye.